Mr. Miller?
Yes, ma'am.
Hi, I'm your nurse Lindsay for the day. I heard you had some questions about your recent HIV diagnosis.
Yes, ma'am. Can you tell me what is HIV?
Okay, so I'll give you some handouts and stuff later, but we're going to talk a little bit. HIV is also called human immunodeficiency virus. It's pretty much a lot of people are scared when they get a HIV diagnosis, but now it's a very manageable chronic disease. A lot of people have a near normal life expectancy when they get diagnosed with HIV now. It's something that's transferred through bodily fluids when you come in contact with an infected individual. You can transmit the disease by sexual contact, that's one of the more common, as well as sharing needles, or a mom could pass it to her fetus. HIV, it's a retrovirus. Pretty much, it's a virus that lacks the tools needed to self-replicate. I know that sounds a little weird, but let me explain a little bit more. HIV, it's pretty much an intracellular parasite, so it's kind of like a parasite inside of you. It promotes immunodeficiency by killing your CD4 lymphocytes, or we call them helper T cells. It's a little bit easier to remember. Your CD4 T cells are pretty much the key component in your immune system. So when you have HIV, it puts you at an increased risk of infection.
Well, is HIV AIDS?
It is not. A lot of people think it is AIDS, but actually HIV was around before AIDS. AIDS was developed quite a few years after the fact. And AIDS is a syndrome in which someone who is HIV positive either has a CD4 T cell count that is below 200, or it can also be someone that has, what am I trying to say? They can have a disease that's associated with HIV, such as pneumocystis pneumonia, tuberculosis, or Kaposi sarcoma. Those are some different things that eventually someone's going to counsel you about everything, and they'll go through the signs and symptoms of these things to look for.
Okay. Well, is it common in African Americans?
Actually, yes. Surprisingly, African Americans have a higher percentage of HIV compared to other races or ethnicities. In 2016, I pulled a few statistics for you. In 2016, 44% of the newly diagnosed cases that we have on record were from African Americans. And it also said that someone that has STDs is at an increased risk for getting AIDS just because of all the higher risk factors. And around 74,000 African Americans in 2016 didn't know their HIV status, which is pretty important. And they'll go over that again. Your counselor will, about making sure that people you come in sexual contact with know their HIV status.
How do I manage it?
So this is another thing, I'll kind of briefly touch the topic, but you're going to go through your primary care physician and a few other people that are going to help you with your day-to-day routine. They're going to give you some medications, talk about your daily routine, managing your diet and exercise, and also about ways to prevent transmission of HIV. So first off, some of the common medications that you may be on. Antiretroviral therapy is also called ART. You're going to hear that a lot. It usually consists of 3 to 4 drugs that you'll be on. And then HAART is also called highly active antiretroviral therapy. It's another common phrase you're going to hear. Pretty much what it is it's meant to decrease the plasma HIV to make it to where those levels are undetectable in your system. And so that those helper T cells are going to return to a normal level. Pretty much, patients usually end up taking 2 NRTIs, which they're meant to prevent the synthesis of viral DNA in your system, as well as either a PI, which is a protease inhibitor, and what that'll do is it inhibits the enzyme required for HIV to replicate in your system, or they may also start you out on an NNRTI, which I know this is a lot of weird. I'll give you all this information later. Don't worry, I'll print it out for you. But an NNRTI is a little bit different. It directly inhibits the replication of HIV. So in addition to all these medications that you probably are not going to remember right away, we want you to make sure you're going to your routine checkups, staying up to date with your vaccinations. We want you to make sure you're eating a healthy diet, healthy balanced diet, and getting plenty of exercise. All this will kind of help make sure you don't get any additional things like pneumonia or the Kaposi sarcoma, which can turn into AIDS. So we'll get you in contact with an HIV expert who's going to help and go through this more in depth with you. So in addition to an HIV expert, we'll get you in touch with a counselor that's going to kind of go over everything with you as well, someone you can talk to, and your primary care doctor that's going to manage everything and get you started on your medications. And then lastly, we want to talk about the spread of HIV. We don't want anyone else to get HIV, so the most obvious way is abstinence. So no sexual intercourse, male or female. And if you were to, use contraceptive devices such as condoms. Also, no sharing needles. Contaminated needles is another way you can spread HIV. And then also making sure you're staying current with your medications, taking those medications every day that we discussed, just to make sure we keep this under wraps. And like I said, you can live a fully normal lifestyle and an average life expectancy.
Thank you.
You're welcome. You have a nice day.